Caladryl Lotion contains Pramoxine, which is used to temporarily relieve itching and pain caused by minor skin irritation such as minor burns, cuts, scrapes, sunburn, eczema, insect bites, cold sores, or rashes from poison ivy, poison oak, or poison sumac. It may also be used to relieve itching and discomfort from hemorrhoids and certain other problems of the genital/anal area. Pramoxine belongs to a class of drugs known as local anesthetics and works by numbing the skin to block the feelings of pain and itching. This product may also contain other ingredients including skin protectants such as calamine, zinc acetate, and zinc oxide. It is important to read the package instructions carefully before using this product, and do not use it for skin irritation in children younger than 2 years or for hemorrhoids or other genital/anal conditions in children younger than 12 years unless directed by a doctor. When using Caladryl Lotion, it's important to follow the directions provided by your doctor. Avoid applying the lotion to severely broken skin areas and do not use it inside the rectum. If you're using the lotion for skin irritation, apply it to the affected area up to 3 to 4 times a day, as directed by your doctor. For hemorrhoids or other anal conditions, apply the medication to the affected area usually after each bowel movement or up to 4 to 5 times a day. Remember to wash your hands immediately after use and avoid getting the product in your eyes, nose, ears, or mouth. If your symptoms do not improve within 7 days, make sure to consult your doctor. If you experience burning or stinging, let your doctor or pharmacist know. Your doctor has determined that the benefit of using this product outweighs the risk of side effects. Serious allergic reactions are rare, but seek medical help if you experience symptoms such as rash, swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so consult your doctor or pharmacist if you notice other effects. For medical advice about side effects, contact your doctor or report to the FDA or Health Canada. Before using Caladryl Lotion, make sure to let your doctor or pharmacist know if you have any allergies to Pramoxine or any other ingredients in the product. This lotion may contain inactive ingredients that could cause allergic reactions or other issues. It's important to talk to your pharmacist for more details. Also, be sure to inform your doctor or pharmacist about your medical history, especially if you have deep/open/puncture wounds, broken/damaged/blistered skin, animal bites, or serious burns. If you are using Caladryl Lotion for hemorrhoids and experience bleeding from the rectum, stop using it and consult your doctor right away. Before having surgery, it's important to let your doctor or dentist know about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, you should only use this medication when clearly needed. It's important to discuss the risks and benefits with your doctor. Additionally, it's unknown if this drug passes into breast milk, so consult your doctor before breastfeeding. When using Caladryl Lotion, it's important to be aware of any potential drug interactions that could affect how it works or increase your risk for serious side effects. Make sure to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. Always consult with your doctor before starting, stopping, or changing the dosage of any medicines. If Caladryl Lotion is swallowed, it can be harmful and may lead to serious symptoms such as passing out or trouble breathing. In case of an overdose, it is important to seek immediate medical help by calling 911 or contacting a poison control center. U.S. residents can reach their local poison control center at 1-800-222-1222, while Canadian residents can call a provincial poison control center. Make sure to keep all of your medical and lab appointments when using Caladryl Lotion. This will help your healthcare provider monitor your progress and make any necessary adjustments to your treatment plan. It's important to stay on top of your appointments to ensure that you are getting the most out of the medication and to address any concerns or questions you may have. If you are using Caladryl Lotion on a regular schedule and happen to miss a dose, simply apply it as soon as you remember. However, if it is close to the time of your next scheduled dose, it's best to just skip the missed dose and continue with your regular application. It's important not to apply a double dose to make up for the missed one. Remember to use it at the same time each day for the best results. It's important to store Caladryl Lotion at room temperature. Be sure to check the product package for specific instructions on how to store it, or ask your pharmacist for guidance. It's crucial to keep all medications out of reach of children and pets. When it comes to disposing of Caladryl lotion, don't flush it down the toilet or pour it into a drain unless instructed to do so. Instead, properly discard the product when it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for the best way to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.